The normal blood glucose range levels for type 1 is typically 3.5 and up. Do you adjust that down for people that follow a low-carb diet? Is there hypos then at a lower level? Do we freak out normal medical care when we run at close to 3.5 or sometimes even 3.3 and then insist that they eat carbs?
This is a great question, and so this question is, what is the normal blood glucose levels, and have we tolerated abnormally high blood glucose levels when we're on a high carb diet? The answer is absolutely yes. So what I find is that people who go into low carb nutrition or very low carb nutrition are able to reliably keep their blood glucoses in a low normal range, and it starts to beg the question, what is normal blood glucose even in non-diabetic individuals? When I wore a continuous blood glucose monitor myself, every night, I don't have diabetes, but every night the alarm went off because it was at 55 milligrams per deciliter or 3 millimolar glucose. And so my daughter said, "Dad, you gotta turn this thing off. It's waking me up every night." And I hadn't taken too much insulin the night before, but I'm thin and athletic. And I think it points out that much of our view of glucose homeostasis is through the lens of high carb nutrition. And so we're going to learn a lot in the coming years.
Yeah, good morning. I've got a question about injecting insulin as a diabetic and how much actually puts you out of ketosis. So when we're giving the Lantus, our long-acting, or even when we're giving the small doses for the protein that we're having, how much is too much?
You know, ultimately the question of getting in and staying in ketosis, I mean, this is a your mileage may vary. There's lots of people like Dr. Bernstein who actually don't advocate for nutritional ketosis. Other people are trying it on their own. The total number of people in the world who are in nutritional ketosis deliberately and have type 1 is very, very small. The most important thing from my perspective is just to think about how you feel. And so if you live with type 1 diabetes, glucose is a fine biomarker and it's really good, but just ask yourself, how do you feel? And are you able to do the things you want to do in life? And in my experience, following a low carb approach and being creative about all the other things that affect glycemia, sleep and exercise and wellness, ultimately should be focused to how you feel, not what your blood glucose level is or what your blood ketones levels are.
Hi, this is for Dr. Kushner as well. I'm a GP, and most of my patients are in the outpatient setting. My question would be regarding the blood ketones. So actually you showed, when you were talking about euglycemic DKA, you showed a number of 2 millimoles, which is not that high for someone who's active and doing intermittent fasting and doing low carb. So what kind of clear information would I be able to give my patients regarding monitoring of euglycemic DKA?
So the question is around euglycemic DKA, which we believe to be a concern. It's not an absolute level. So if your beta-hydroxybutyrate oscillates in between 0.5 and 2, that's not a big deal. But if you normally sit in between 0.5 and 2 and you are now throwing up and your beta-hydroxybutyrate is 2.5 or 3, that's a concern. So it's the rate of rise. It's related to how you feel. It's also correlated with any potential for interruption of insulin or other life-threatening illness. And it's putting it in a context. We don't have simple answers. We're still in the very early stages of diagnosing and treating euglycemic DKA. What do families need to know? If you're in trouble, consume carbohydrate and lots of insulin and reverse the metabolic state. Don't be shy about doing that. Let the crisis or the potential crisis subside and then get yourself back to homeostasis.
Right, here's trouble. Here's one of the keto dudes.
Thanks, Peter. I'm going to ask a question to Dr. Phinney. This is a question about the process of science, and specifically with the Verta studies. A lot of your process is a proprietary system, a proprietary application. Is that a challenge to produce reproducible methods in scientific papers so that somebody can reproduce? I know a lot of people don't tend to reproduce studies these days, but is that a challenge to publication?
Excellent question. Almost everything we did in terms of diet and lifestyle advice for our patients and patient management is published in our Art and Science of Low Carb Living book. What is not easily reproducible by others is the delivery software. That's a difficult problem. So if somebody makes something called like the Dexcom continuous glucose monitoring device, and you study it and show its effects, the Dexcom device is kind of like our app. It's out there, but if you want to study it, you have to get access to that device. And by the way, we at Virta are very promiscuous in terms of who we'd be happy to do studies with. We are completely open to individuals who want to use our tool to study something in their setting. But when we set out to do a study, there just weren't that many people who were interested in what we're doing. In the last 2 years, that's changed dramatically. But the first person we found who said, yes, I want to do this in my patients was Dr. Sarah Hallberg. And I cannot say enough how remarkably brave she was to bring this into her practice, and as a practicing physician to not endorse our treatment, but be willing to study it and put it out in the public domain.
2 more questions.
Hello, my name is Rochelle Martin. I'm a nutritionist from South Australia. My question, we've talked today about type 2 diabetes, and we've talked about type 1 diabetes and the low-carb diet. I'm also a mother of 4 adult boys and during that time I had gestational diabetes, which was quite severe with all of them. I was also morbidly obese. So my question to you is, what are we doing with low-carbohydrate diet and gestational diabetes? Is there anything happening with that at the moment?
I was at a remarkable conference in Switzerland back in June, which was hosted by BMJ, the British Medical Journal editorship, and a large Swiss insurance company. And that was one of the questions. They asked me to address that. And my answer was, but I think really it was very depressing for the audience, and that is there are barriers to studying, of doing prospective studies with ketogenic diets during pregnancy, because there is some epidemiological data, not prospective data, that suggests that for mothers who were found to be in any form of ketosis in the 3rd trimester, that follow-ups on their children demonstrated delayed development. But this was published in the 1990s. And the most likely cause of the mothers being and this is just reviewing hospital records, was that they were seriously ill and/or had type 1 diabetes, had inadequate care. So it doesn't speak anything to the potential value of nutritional ketosis during pregnancy, which will keep insulin levels down. And maybe Dr. Kushner can speak to the potential effect of hyperinsulinemia, hyperglycemia during development, and increased beta cell mass and abnormal pancreatic function later in life. But we have to find a way to get past that barrier. But it's not the scientific impediments, it's the political impediments that are in our way.
Women's health and reproductive health have been hopelessly understudied in both type 1 and type 2 diabetes, as well as gestational diabetes. There's a lot that we need to do.
This is not a question, but a comment towards you, Professor Phinney. Ladies and gentlemen, for all the doctors and all you patients out there with type 2 diabetes, we had always been taught that type 2 diabetes is a chronic progressive disorder that can never be reversed. You've got a lifetime of increasing medications, and eventually you will end up on insulin. What we have heard today, ladies and gentlemen, is groundbreaking, and we need to stand up and applaud this fact that we had 46% reversal and 60% remission in those who managed to last year. That is absolutely astounding. Well done, Stephen.
I'm one small member of a large team. As I said at the start, I got kidnapped and forced into doing this by some technical gurus from Silicon Valley, and that applause was for them and for Dr. Sarah Holberg. Thank you.